Welcome, everybody. Good afternoon. It's a beautiful afternoon, at least in the Philadelphia area. And welcome to the groundbreaking of the Frazier Family Coalition. You know, this is a dream that started with a casual conversation with the Fraziers, with Andrea and Ken, and with their guidance, it has become a reality.
When it came to stroke, when it came to diabetes, as Robert said, when it came to obesity, where you lived and your social determinants were probably the most important piece. So it's just such an honor for me to have Jefferson be a side temple. It's an honor for me to have Andrea and Ken Frazier's name in something that we're doing. Thank you so much for your willingness to be collaborative and to do great things.
We're grateful for the colleagueship of all the Jefferson and the Temple teams. I'd also like to thank the Nicoletti family for their generosity in providing space. And I'd like to thank our Community Advisory Board for its important involvement. I especially want to thank Andrea and Ken Frazier. Your family, without a doubt, has deep roots in North Philadelphia. You know the need that exists among many of its residents.
I see the true generosity, and not only the financial generosity, but the generosity of time, the generosity of leadership, the generosity of good thought. I just want to say, on behalf of Jefferson, on behalf of Temple, on behalf of the American Heart Association, and on behalf of all of the people who are going to benefit for decades from this coalition, thank you.
We are thrilled to be a part of this project, and we are so honored to be able to look to our neighbors in North Philadelphia and offer them some relief from the kinds of illnesses, chronic illnesses, as well as strokes that they have been suffering with for many years. I am a stroke survivor. I had a stroke 31 years ago when my daughter was born, and I was fortunate enough to be delivered into the care of Dr. Rosenwasser. 1 in 3 women will have either a cardiac event or a stroke during the course of their lifetime. That is an extremely high number, and we are hoping that we will be able to provide education and access to healthcare so that we can help to mitigate the suffering and the extremely high numbers that come from living in a certain zip code.
You know, over the past couple of decades, I think in our country, we've seen shocking amounts of inequality. It is my sincere hope that with this, we'll be able to help address some of those shortcomings. And I want to thank again everyone who's committed to this. And we look forward to seeing great things happen in my old neighborhood of North Philly. Thank you.
My sisters and I can say with so much humility, we're actually grateful for the opportunity to work with this team. You should all be commended. I mean, you're going to ground zero. And Andrea, you're right. Don't underestimate the power of hope. For people who get up every day desperately just trying to survive, sometimes that's all they have. And this project is going to be absolutely transformational.
Healthcare is by its nature a holistic enterprise. It's a team sport. It's a team sport that involves widespread collaboration across boundaries of all sorts. And that's especially true for our institutions that provide healthcare. Jefferson and Temple have truly taken a bold step forward to collaborate. And I really mean collaborate. And I think our 2 institutions are leaders.
It sort of hit me that every single toast, no matter what your culture is, to life, to your health, l'chaim, salud, prost, whatever it is, think about that. Every single toast when people are getting together is to your health. We want everybody in Philadelphia, in every zip code, to be able to say to your health and mean it and have that opportunity. That's what this is about. And Andrea and Ken, you are starting that fire, and I give a virtual wow toast to you.